What if we told you coffee was good for you?
Coffee is the single highest source of antioxidants in the Western diet. More antioxidants than kale, more antioxidants than 70% dark chocolate, and more antioxidants than blueberries.
In fact, what if we told you that coffee is really good for you?
Research shows that 3 to 5 cups of coffee per day dramatically enhances performance in high-intensity exercise, improves memory, reaction times, and overall cognitive function, decreases risk of depression, promotes weight loss by boosting metabolic rates, reduces risk of type 2 diabetes up to 40%, decreases risk of liver cancer up to 71%, reduces risk of Parkinson's up to 30%, and decreases risk of Alzheimer's up to 65%. Overall, coffee drinkers live longer. People who drink 3 to 5 cups of coffee per day have about a 15% lower risk of premature mortality compared to people who don't drink coffee.
And what if we told you that the health benefits of coffee could actually be increased through conscious roasting, sourcing, and processing? Introducing Purity, a health-conscious coffee company. At Purity, we've brought together a world-class team to analyze every step in the production chain from cherry to cup. We make decisions with only one thing in mind: how can we make the healthiest coffee in the world? Here's our 3-step process. Step 1, we search the world for the highest quality organic green beans that meet our exacting standards. Way less than 1% of coffee worldwide fit our sourcing criteria. Step 2, we test, and test again to create a specific roasting protocol for each harvest that maximizes healthy compounds and minimizes toxins. Step 3, we nitrogen pack our coffee within 48 hours of roasting and deliver to your door every 2 weeks to ensure maximum freshness. The result is the ultimate coffee drinking experience. You'll not only taste the difference in our clean, healthy coffee, with Purity, you'll feel the difference.
Our coffee club members report a bright, alert lift with less jitters than regular coffee and much more gentle on the stomach.
Sign up for Purity today, and you'll never have to worry about your source for healthy coffee again.
Good afternoon. Happy Saturday. You're listening to the Ask Dr. Ernst show. Hey, it's a show where pounds are shed and disease is dead and where you can be set free. That's the whole point. Being set free from chronic disease, from aches and pains, from weight loss resistance. Dr. Chris, always just an absolute honor to have you here today.
Pleasure.
What are we setting people free from today? It's that old school Uncle Arthur. Arthritis.
That's right.
That, I woke up in the morning and my back is on fire, or, my feet are achy, or heaven forbid you have an autoimmune version, which would be like a rheumatism or a degenerative, arthritis. Hey guys, sorry, my camera's freaking out. Oh, we're still live. Okay, good. Hey, listen, if you don't know this, we live stream every single show, every single week on YouTube and Facebook and Instagram. So if you want to get connected to the live stream videos, basically hit up any social media channel with /Ask Dr. Ernst. That's AskDrErnst. Right now, we're looking at our live streams on YouTube. Hey guys. And we've got our Facebookers.
That's right.
And we've got our Twitterers. Is that even a phrase? Twitterer.
It should be if it's not already.
Yeah. We got our tweeters and our Instagrammers. So hey guys, we love that you're here.
That's right.
And
Thanks
our message of health and healing is finally conquering this thing called arthritis. I'm going to just throw this out. You were not meant to have arthritis. And today, man, we're a little tired. Just get this. We had a massive seminar this morning. It was on type 1, 2, 3 diabetes. If you've been listening to our show for any period of time, you know our existence is to teach you how to heal yourself. That's right. And my God, we had 390 people online. Yeah. Massive transformation. We had type 1 diabetics going is this real? Serious? I can drop my insulin usage? We had video testimonials of patients who have cut their insulin back, A1C down. And I hate to say this, a lot of our skeptics, our trolls, if you will, you can't reverse diabetes, Dr. Ernst. It can only be managed. Yeah, I don't know about you, but you don't manage debt. You reverse it. You don't manage, your health. You heal it.
That's right.
So if you've been told diabetes is incurable, hey, you're listening to the wrong person. If I go to a Toyota dealer, they're never going to tell me to buy a Honda, ever.
Right.
So does that mean they're right? Well, in their mindset, yes, they think the best car on the planet is a Toyota, but what if there's something better out there that you didn't know of because you're being lied to?
And here's another way to look at it, guys. If you're being told that you can only manage a certain disease like type 2 diabetes, that means you're being stagnant, and you're going to choose to be stagnant. Is life stagnant? Is our health ever stagnant? No. You're either heading towards disease or you're heading towards health and healing.
Listen,
You've got to make that choice.
I get it, okay? I've been taking my medications for years. I've been losing weight. I've been exercising. My A1C dropped to 5.7. My doctors are super happy, but that's still pre-diabetic. So listen, if you missed that event, heaven forbid, but if you missed it, or if you're somebody listening today and you're like, whoa, I had no idea you did a How to Fix Diabetes in 90 Days seminar.
Yep.
We are doing a reboot. It was such a huge event that we said, you know what? We can't let this information just slide. So exactly 2 weeks from today, on the 4th of June, my associate doctor, Dr. Rice, is taking the responsibility to take you guys through it again if you need. Some of you are like, whoo, this is great, but I need more information. So join us for that.
That's right.
And if you're kind of like, wow, I didn't even know you guys were doing this. Saturday, June 4th, 10 a.m. It's part 2, right? Did I pronounce it right? DUEX, part 2. All right, of the metabolic makeover, the reversing diabetes. Look, it's also weight loss, energy, health transformation. Yep. Diabetes is the side effect, guys, of your underlying health issue. So if you want to join us, and also as a bonus, we'll keep giving away that diabetic ebook that we wrote. There was over 3,000 downloads in the last month. My God.
People are loving it.
So you guys love the book, you love the seminar, and if you're like, man, I missed it. I don't know, we were told once, the fear of missing out, the
FOMO.
fear of loss is greater for most people than anything else. So we don't want you to miss out. Saturday, June 4th, 10 a.m. How do you get access to that? Well, you have to do one thing. Text your name and your email to 704-906-2094. Guys, it's that easy. Literally, just pick up the phone, 704-906-2094, and you say, my name is, my email is, send. If you're not a texter, just call the number. We have a call center. They'll just ask the same thing. What's your name and your email? 704-906-2094. All right, I think announcements are done. So let's get into the nitty-gritty of this. Can you give people a picture today, Dr. Chris?
Yeah.
Like, what is this thing called arthritis? How many people deal with it? And what does your classic person think they can do with their arthritis? Like,
Gotcha.
is it reversible? Is it something they have to live with? Like, what's the average person think when we say the word arthritis?
So first of all, I like how you put the words, what can the average person with arthritis can do?
Yes.
'Cause I'm sure most of you that have arthritis are going, this is all the stuff that I can't do anymore that I want to be able to do. But guys, get this. It's estimated that some sort of arthritis is affecting over 33 million Americans right now. That's crazy. That's way too much. And what is arthritis exactly? Arthritis is a breakdown in the bony structure or the joints, right, where two bones meet, and that's causing where there's a lack of the cartilage between the bones, or there is a change in the bone structure, right? You might hear some fancy words like an osteophyte. You've got some extra bones hanging out in the joint space that shouldn't be there, and that leads to pain. That leads to further dysfunction. Your body's got to try to compensate for all of that. So let's use, how many of you have trouble walking up or down the stairs because your knee hurts? And you've gone to the doctor, your medical provider, and they've said, oh, you've got osteoarthritis, right? You've got arthritis in the bones of the knee joint, and that's causing your pain, right? And so then every time you walk up and down the stairs, you've got this searing pain. You've got to try to change and do something different. So because your right knee has your arthritis and your left leg does not, you just try to use your left leg. But then another month or two goes by, and what happens? Now your left ankle is hurting, and oh my gosh, your left hip. And now the muscles on the left side of your low back are starting to kill you. So you're like, I can't go up or down the stairs at all because I've got problems both on the right and the left.
So here I am, and I'm suffering from all this pain, and I'm kind of like the classic person. I don't want to go to a doctor about this. I'm going to have a high deductible fee.
Right.
I'm probably going to have to, they're going to tell me I might need surgery. So I run off to CVS, Walgreens, Rite Aid, and I get the Advil arthritis, joint and pain relief.
Yeah.
And so talk me through this. Like, is that helping me? Is that helping the arthritis to get better? How does that work?
Yeah, and let's go even deeper, guys, because there's all these, I'm not going to name specific names of medications, but there's all these creams that are coming out that are supposed to help relieve the joint pain, relieve arthritis pain, that are doing the same thing if you were going to take the pill by mouth, right, if you were to take one of your generic Tylenols or Advils. But
so hold up. Are you saying the homeopathic CBD menthol-infused arthritis gel, that's not actually going to help my arthritis?
Is it going to make the bone resorb? Is it going to make the fluid go back into the joint? Is it going to rebuild the cartilage in the knee that's gone anyways? Of course not. No, absolutely
It might
not.
hide the pain.
Right, but the pain will go away.
How about this? If my knee's hurting and someone punches me in the face, am I going to feel my knee pain?
Well, if we really get into it, you know what? The pain in your face might actually start blocking the signals that's being sent from the knee with the pain.
Exactly.
So, yeah, hey, real quick, guys, as an aside, have you ever thought about why when you were a kid and you bruised your knee or you fell down, something hurt, why your parents just said, oh, just rub it really quick, or they went over and did that, and it worked, and oh my God, the pain went away.
Yeah.
Why did that happen, right? Your body can only control really one signal at a time, and we send different signals on different nerve fibers. So if we have pain signals coming from our knee up to our brain, and then we also have movement signals because our mom or dad's rubbing our knee to make the pain go away, there's a movement signal and there's a pain signal. That movement signal is going to beat out that pain signal, and only that movement signal is going to get up to our brain, and so we only interpret that, and the pain lessens.
Yeah, they call this the walk it off therapy.
Yes.
Right?
Yes.
You're playing soccer, you trip somehow, you kind of like sprain your knee, it's swollen, it hurts, and you're kind of limping around. They used to be like, get him off the field, go ice it down. Now they're like, nah, man, get up and keep going. Yep. Because the movement not only blocks the pain, but it actually ensures the joint stays stable.
That's right.
And if you ice them down, you actually cause more problems. Now we're learning this now.
In the long run.
So walk me through this again. I'm 55.
Yeah.
I'm going up and down the stairs. My knees hurt. I'm waking up in the morning. My back hurts. But by like 2 or 3 o'clock, I'm pretty good. I've warmed up. I feel great. And I'm taking the Tylenol joint pain. I'm taking the Motrin joint pain, and I'm okay. Like, as long as I take those pain pills, my arthritis doesn't bother me.
Right.
So am I good? Or like what's going on?
Well, of course not, because your body's still trying to deal with the underlying problem, the root cause, as we always like to say here on the show. So you haven't addressed the root cause, right? Which is there is some imbalance that's leading to the increased pressure, let's say on the right knee, that's caused the right knee to degenerate over time. Do you think, and if you're listening to this and you know this, that you have knee pain or you have some sort of arthritis anywhere in any joint of your body, not just your knee, when did that first come on? How long has that arthritis truly been there? Did it just happen overnight?
Yeah, but see, you're talking about, you know the knowledge and the answer.
Right.
To the average radio listener, yeah, I was fine the day before, and today, bam, my knee's hurting me, and this whole week, my back's bothering me. I'm noticing like my hands are stiff.
That's right.
And if I'm looking left and right, I hear this. So like it just started for me.
Right.
Didn't it?
No, of course not. Right. And so yes, as physicians, we understand that compensation process, that adaptation to create the arthritis that is now in your body somewhere, that started years ago.
Yeah.
Years ago. And it just only got to the point where the alarm bell started ringing maybe yesterday for you.
So think of it like this. We know diabetes doesn't just show up one day.
Right.
Like your A1C is slowly creeping up and your sugars
Yep.
are slowly creeping up. And because the average American never checks their sugars
Yep.
and only once a year checks their A1C if they're
Right.
lucky with their
Right.
physician, you could have had diabetes developing for 10 years before you get diagnosed. Now, most people know this, right? The day you leave your physician's office with a cancer diagnosis, you didn't have cancer the day before. Wait a minute, you did. See, you didn't just wake up and all of a sudden, bleh, some cancer's in your body. It's been there. Listen to this. The research says 10 plus years. So 10 years prior, you had these small cancer cells in your body, but you didn't have enough for them to see it, smell it, taste it, however they look for it today. Do you know there's dogs that can smell cancer?
Really? No,
So they have these dogs. They can sniff around a human being, and they'll sit down next to them. And what they found out is if they're trained to smell certain cancers like breast cancer, prostate cancer, and they're smelling your body and you have prostate cancer, the dog will sit down next to you because it's trained for that. So like, wait a second, man. If a dog can smell the odor of cancer, but we can't.
Right. I was just going to say, does that mean that the person with the prostate cancer knows they have it yet?
No, I guarantee you that man's like, why is this dog sitting next to me? And they come up and like, well, listen, unfortunately, this dog's trained to smell cancer.
Wow.
You got small amounts of prostate cancer. Well, no. Yesterday I was at my doctor. My PSA is normal. Careful. So now listen, if you're somebody and you're like, whoa, you just blew my mind. Like I could have a problem now, even though I feel fine. Yes. So how do you discover what your health truly is? Well, one thing is pretend you have a disease. We said this a couple weeks ago. If you want to truly never have diabetes, pretend you have it right now.
Yep.
Start testing yourself right now. Start finding out your numbers. And hey, if your numbers are in the clear, thank God. But if you're at like slightly early pre-diabetic, treat it now and you'll never get it.
Exactly.
It's the same thing with arthritis. I wake up, I'm 43 years old, and I'm kind of like, things are getting a little stiff. But that doesn't mean I have arthritis, but it means I need to start treating myself like I do. What's going on with my joints? What's going on with my diet? We're going to talk about the causes in a second. But if you're listening right now and you're like, whoa, listen, Dr. Ernst, I fall into second category. I've been medicating myself for years for heart disease, diabetes, Parkinson's, whatever, cholesterol, triglycerides, sugars, and I want to get off those. That's a different story. Wake up. And you can make a huge movement. Yep. But if you're like this, like I woke up today, I feel fine. My doctor says I'm fine. Everything's good, but I'm in my mid-40s or I'm in my mid-50s. You need to have a functional exam done, right? In my opinion. So why would I hop on this webinar that we're going to do as a replay? Even if you don't have diabetes, I would hop onto it because it's going to teach you the core concepts of health. It's going to teach you the tests that don't just look for diabetes, but like we're talking about minerals, vitamins, amino acids, your detox pathways, your gut, your kidneys, your liver, my God, your toxins, heavy metals, system, the strength of your immunity. Watch this. How old you are on the inside. Like we did the test yesterday, right?
Yep.
I came back at 38 years old and I'm 43. What was yours?
I came back at 26 and I'm 30.
Come on. Like you guys, you've got to get these tests done. So if you're interested, you're going to text your name and email now to 704-906-2094. Yep. Why? You're getting an ebook that teaches you about diabetes. But Dr. Ernst, I don't have diabetes. Prove it to me then. Right. Because you know how many people say, I don't have diabetes, we run a test on them, and you have pre-diabetes? Careful. So again, it's 704-906-2094. Text name and email, or just call it. We have a beautiful call center. They'll pick up. Hey, thanks for calling the Ask Dr. Ernst show. What's your name? What's your email? Give it to them, and we'll get you registered.
Yeah, and here's the other thing, guys. If you were, let's say you don't have diabetes, but then you call, you get the ebook, it's sent to you, you read it, you go, oh my gosh, Dr. Ernst was right. I should be acting like I have diabetes and looking to do something about it.
Yeah, or act like you have heart disease.
Right.
My God,
do
you know
something
what?
about it.
This is what everybody should do. You should act like you have cancer, because technically you do, but it's not diagnostic yet.
Yeah.
Okay. I ran a test. You guys are gonna think this is nuts, and you like some people are like, "Wow, I would totally do that." It was $900. It checked me for 50 kinds of cancers. Now you know what was scary? One of them came back slightly positive. So I was screened for 50. One comes back saying early indicator. All other 49, negative. You know what I said to myself? Whoo! I got to start focusing on that. And it's in a lymphatic channel, which means I've got lymphatic congestion, which means if I don't fix this, I'm going to end up with a lymphoma, which is a big deal. Now, how many of you would spend $900 on a test that would tell you if you have early stages of 50 types of tumors? I think that's cheap.
It is. Well, think about in the long term, let's say you develop the cancer, you've got to go through some sort of treatment plan, or you choose to go to the medical route. How many thousands upon thousands and tens and hundreds of thousands of dollars is that going to cost?
My God.
$900.
Now watch this. Let's say I schedule an appointment with an oncologist today. You see where I'm going with this, right? So here I am, 43, go to an oncologist, and I say, hey, screen me for lymphoma. You know what's going to happen? It's going to come back negative, and they're going to say this: you don't have it.
And they're also going to say, hey, you're not in the right age range.
You have no risks.
You have no risks.
You have a family history of some lymphomas, but like it wasn't until they're 60.
Yep.
My God, look at your stats and your numbers. Your cholesterol's low. Your sugars are near zero. Like the likelihood of you having, this is a medical doctor, the likelihood of you having lymphoma is like zero.
Right.
Yet my functional screening says I've got one click against it already. Come on. Now, let's talk about arthritis. Okay? Let's use the same analogy. I go to my medical doctor, my internist. How are they screening us for arthritis? It's a joke, guys. Listen to this. How does an MD screen me for arthritis?
They ask you, hey, do you have any joint pain? And that's it.
Completely subjective.
Right.
No. Now, if you do say something like, I'm a little sore and achy in the morning, my hips are a little tight, what are they going to tell you?
Well, they're probably just going to say, well, you know what? Could be because maybe you're sleeping wrong, or maybe there's some inflammation there. Maybe you need to take this medication that'll just calm it down, and then you'll be okay.
Or how about this? Like my internist. Well, Dr. Ernst, you are in your mid-40s.
It's
Welcome
normal.
to the club of arthritis. It's normal. But what they say is this. It's so common. It's so commonplace that it's normal. It'd be like this. So you're from New York, right?
Right.
So you're going to go to Brooklyn.
Sure.
And you're going to get mugged. It's pretty normal, isn't it?
No.
It's common. It's really common,
yes,
but it's not what
normal.
should be happening.
Right. And yeah, we could go off endless examples, but keeping it in the health spectrum, in the health sphere, that's something we've been talking about this week even, the normal variance in health.
Oh my gosh.
Right. And I mean, we've been talking about the pineal gland and the brain, and we can get into that another time. But
how about just this statement, right? Is it normal to be healthy?
Yes.
But yet it's normal to be unhealthy medically.
It's normal to have abnormal things. That's
so
what they
the
make.
abnormality has become the normality.
Yep.
It's typical for an adult to take 2.6 medications if you're over the age of 40.
Yep.
The average adult is 2.6 medications every day swallowed. That's become the new normal.
Yeah. And you know what I'm just thinking about right now? Remember how we were at that conference last weekend?
Yes.
And there was a graph that talked about how when a patient is subluxated, has symptoms, unhealthy, no symptoms, unhealthy,
that's right.
Symptom-free and healthy.
Think about
that's
how
something
hard,
that the patient.
Think about how hard
this
is for you to grab this. Ready? You have no symptoms, but you could have an underlying cause creating the future symptoms that you're going to have. So do you wait till you become symptomatic to deal with it? Do you wait till you become cancerous diagnosed by an oncologist to deal with it? If that's the case, no wonder we only have about a 5% tops success rate, 95% failure rate with cancer in the U.S. What about the failure rate of reversing arthritis in the US medically? Guys, we're at 100% failure rate.
Yeah.
When's the last time your doctor said, hey, you've been taking Celebrex and Percocet and Oxy and all this stuff for your pain of arthritis for like 6 years? And guess what? Your labs came back saying your joints have fully regenerated and you have no pain in your body.
Yep.
Well, doc, my knees still hurt. Not according to the labs. According to the labs, your knees are fine. That never happens ever, guys, ever.
No.
If anything, they become addicted to the pain pills.
Right.
It affects their metabolism. They start gaining weight like crazy. That puts extra stress in their joints. Their joints start hurting more. And their doctor's like, well, we can just up the dose.
Right.
Oh, by the way, you should exercise more. Damn, I hurt so bad I can't work out. Well, then you should diet. Oh, I'm eating sticks and rocks and bugs and nuts and seeds and I'm gaining weight. And the doctors go, well, you know what? It's your genetics. I'm so sorry. You were born with a bad gene for arthritis. Lies!
Yep.
All lies.
Absolutely.
Okay, so we've got 50 seconds before the commercial. But here, guys, I'm going to tease you. Second half of our show, natural treatments, the real functional cause, and watch this. Something you can do right now today that should take your arthritis pain away in 5 to 10 minutes. So you wake up in the morning, you do this special thing that we're going to give you as a secret, and it goes away like that. How would you like to learn that? Don't go away during the commercials. Don't tune out. Don't go to another station. Hey, Facebook, YouTube. Yeah, you can scroll around if you want, but come back in 5 minutes. Hey, guys, it's the Ask Dr. Ernst Show. We're opening up our call lines once more for the free, I'm going to say, health seminar. But yes, it's themed to diabetes, but it's weight loss, energy, vitality, essence, lowering A1C, lowering blood sugars, lowering triglycerides, lowering cholesterol, lowering everything. And that is on Saturday, June 4th, 10 a.m., free. And you get an ebook that's going to have all the information you need. 704-906-2094. Or text your name and your email to that same number. 704-906-2094. Don't go away. We'll be right back.
What if we told you coffee was good for you?
Coffee is the single highest source of antioxidants in the Western diet. More antioxidants than kale, more antioxidants than 70% dark chocolate, and more antioxidants than blueberries.
In fact, what if we told you that coffee is really good for you?
Research shows that 3 to 5 cups of coffee per day dramatically enhances performance in high-intensity exercise, improves memory, reaction times, and overall cognitive function, decreases risk of depression, promotes weight loss by boosting metabolic rates, reduces risk of type 2 diabetes up to 40%, decreases risk of liver cancer up to 71%, reduces risk of Parkinson's up to 30%, and decreases risk of Alzheimer's up to 65%. Overall, coffee drinkers live longer. People who drink 3 to 5 cups of coffee per day have about a 15% lower risk of premature mortality compared to people who don't drink coffee.
And what if we told you that the health benefits of coffee could actually be increased through conscious roasting, sourcing, and processing? Introducing Purity, a health-conscious coffee company. At Purity, we've brought together a world-class team to analyze every step in the production chain from cherry to cup. We make decisions with only one thing in mind: how can we make the healthiest coffee in the world? Here's our 3-step process. Step 1, we search the world for the highest quality organic green beans that meet our exacting standards. Way less than 1% of coffee worldwide fit our sourcing criteria. Step 2, we test, and test again to create a specific roasting protocol for each harvest that maximizes healthy compounds and minimizes toxins. Step 3, we nitrogen pack our coffee within 48 hours of roasting and deliver to your door every 2 weeks to ensure maximum freshness. The result is the ultimate coffee drinking experience. You'll not only taste the difference in our clean, healthy coffee, with Purity, you'll feel the difference.
Our coffee club members report a bright, alert lift with less jitters than regular coffee and much more gentle on the stomach.
Sign up for Purity today, and you'll never have to worry about your source for healthy coffee again.
Hi, my name is Gary Greenfield with Greenfield Water Solutions, and I want to introduce you to our newest product, the MR500. It's a whole house structured water filter system. It's set up in an all stainless steel multi-round filter housing. It features inlet and outlet for the water, a bleeder valve for when you're changing out the filters to reduce pressure, and to remove the top for access to the filters, we simply open up the clamp, remove the top, and this plate here holds all the filters in place. Simple to remove. It comes out, and you can see what we have on the inside here. It's 5 Aquamedics filters and a vortexing tube and a harmonizer. That's the whole system. This is designed to filter 5 gallons per minute, and all of the contaminants that it does remove are listed on the website, which is a very broad array of contaminants. These are the highest rated filters that I know of on the market that are filter cartridges. They can be changed out yearly, and of course the process is very simple. You won't have to hire a plumber to do a change out, and the filters are available from Greenfield Water Solutions. And if you want to know more about this, you can read about it on the product page or give us a call. Thanks for watching. That's it for now from Greenfield Water Solutions.
Would you like to experience a better night's sleep? Want to feel well rested and ready for your day? Discover an amazing solution with Celient Sleep Recovery. Our Celient Sleep Recovery products are made from a patented yarn embedded with a blend of 13 infrared active minerals. Celient technology never washes out. The benefits will last for their entire lifespan. Minerals reflect the body's own energy by using Celient infrared active technology, boosting your oxygen levels and improving circulation to reach REM sleep gracefully. Our customers love to comfortably sleep throughout the night because of Celient. We've conducted 9 independent clinical studies by well-respected scientific institutions and universities that prove the many positive effects Celient has on the body. Our technology is designed to help you achieve a refreshing sleep recovery. Experience the foundation your body deserves. Start waking up refreshed and always ready for the day ahead. It's time to achieve the best sleep of your life to unlock your hidden potential. Start experiencing a better night's sleep with our Celient Sleep Recovery products today. Celient. Recycle your body's energy.
To bring you the best natural wine the world has to offer, we've designed a fully curated membership program. Every selection you receive is different and unique. Every wine is picked by our wine team, lab tested for purity, and curated into a special box for your enjoyment. So how does the membership work? We offer 2 main options: a half case of 6 bottles or a full case of 12. You can request all reds, all whites, or a perfect split of both. Then you can set the frequency, monthly or every other month. We offer a similar simple membership for rosé and sparkling wines. After you choose these basic options, we'll do the rest. With every box we send you, we aim to present the greatest diversity of flavors, textures, and profiles. There is a healthy mix of the classics, but also rare varietals. We do this because natural wines taste different from their commercial counterparts. We want to share the best possible experience with you so you can discover new wines you love. And you can always reorder a wine that took your heart, or ask us to avoid certain profiles. The best part is, you don't need any wine knowledge to fully enjoy these boxes. We curate our selections to be enjoyed without worry. Ultimately, this is Dry Farm Wines. We are so grateful to be able to share the power of natural wines with you.
Welcome back. Happy Saturday. You're listening to the Ask Dr. Ernst show. You know, we should also call it the Ask Dr. Demczar and Ernst. It's the,
I love that.
That's the tough one, though. Hey, it's the Ask Dr. Ernst Demczar show. But anyway, we're here today discussing this concept that arthritis, that joint pain, achy, swelling. Look, there's different types. We're going to talk about those in a second. But if it's the classic, most common arthritis, it's degenerative osteoarthritis. It's the wear and tear that we got to talk about, where it gets in your hands and your knuckles start to get swollen. You know, your joints become difficult to move. It gets in your hip and it gets stiff and tight, you know, and then it hurts. It gets in your knee, one or the other or both, and it's hard to go up and down the stairs, and it's hard to sit and squat. It gets in your feet. Man, that's hard. You know, most people are like, I didn't realize how much I actually use my feet.
Right.
Well, you walk on them every day.
I know. It
can get in your spine. Oh my gosh. Then we get bone spurs and osteophytes and all kinds of crepitus. Some people even go like, it's as far as I can turn left, and it's as far as I can turn right, and it's as far as I can go up. Man, that's bad.
Good luck driving.
Degenerative spinal osteoarthritis, DJD as it's called, degenerative joint disease. It is so common today. You said 33 million. That's the autoimmunity version. 50 million Americans struggle daily with this degenerative osteoarthritis. And look, there is an autoimmune version. Your body is confused and it starts attacking your joints. That's different. That's rheumatism. That's psoriasis. Those are heavy players. Can those be reversed though? Yeah,
of course.
But they're minimal, right? So 20% of the population deal with that. 80% of people have the uncle arthritis knocking on their door. 40 years old, 50 years old, it starts showing up. You know, my joints, I'm getting stiffer. And look, we've been told medically it's your age. And listen, let's dispel that real quick. If age caused diabetes, if age caused arthritis, what would be the age it would show up? Just give me a random age.
Oh gosh, but it could be any age. But you wouldn't
just
think
pick an age. I'm going to use an analogy
80.
for you. Okay, if arthritis shows up at 80, every 80-year-old on the planet would have arthritis. And do they? No. Now, if it was 68, like 68's the magic year. Oh man, next year I turn 68. I'm going to get arthritis. No, it doesn't work like that. Okay, second, genetics. They claim that because you have a family history of arthritis, well, hey, look, your dad had a bad hip, didn't he? Yeah. Well, that's why you have a bad hip. Come on. Really? Okay, if you had a gene that was defective, that was making you arthritic, you'd be like a 6-month-old baby with arthritis.
Right.
Which does happen.
It does, unfortunately.
But you know how rare that is? Like half of a millionth of a percentage.
Yeah.
Okay, so it can't be your genes, because if it was, you'd have it all your life. It can't be your age, because if it did, as soon as you click that magic arthritis age, you'd have it. So what the heck is actually causing this?
Yeah.
And what can you do to turn this around super fast? And watch this, guys. What can you do to regenerate and rebuild those joints? That's the secret.
Yeah.
Okay, so walk me through what's actually really causing the arthritis.
Sure.
And why does it only show up on one side, not the other?
Sure. Yeah. Good call. Absolutely a great call. So a couple things. When we break down the word arthritis, right? That itis, and you hear that for lots of things. Everything can have an itis to it. What is that? Inflammation. So inflammation of what? Arthro means joint. So arthritis is inflammation of your joint.
So hold up. My doctor's just diagnosing me with the terminology of what's causing it. So I leave the office. You have osteoarthritis. Oh man, gosh. So if you do the research on the words, they're saying that your joints are inflamed, aren't they?
That's right.
So they just told you what's causing it.
Exactly.
And you're taking Motrin and Tylenol for this.
Yep, something over the counter.
Keep going.
Okay, so you've got this inflammation of a joint, right? And why is it only one side? That's an amazing question. It's because you're placing more stress on that one side over a long period of time than you are on the other. That's what we talk about, that neural interference pattern all the time.
Alignment.
And an alignment interference, right? If there's an alignment that's off with your spine, that causes your hips to shift one way, causes you to not have balanced weight in both feet, but you put more weight on the right side than the left, let's say, and before you know it, you're having years of compensatory motion to put more weight on the right side. It's going to lead to those arthritic changes.
Let's use an analogy they can understand.
Yeah.
I just bought a brand new BMW M3.
Love it.
Brand new tires. It's got 0 miles on it. And my first trip is to California and back.
Woo, it's far.
And I don't know, leaving Charlotte, I hit this pothole.
Yeah.
Boom. I guarantee you my tires are out of alignment now.
Right.
But I don't feel it. It's a brand new car, guys.
Yeah.
Okay, so I go to California and back, and then what's going to happen?
Right. So before you know it, then let's just say that a week after you get back, and let's say it's the middle of winter, and it's the right tire that hit the pothole, and next thing you know, you go over a sheet of ice, and the right tire starts slipping. But the left tire was fine because that right tire was wearing down way more so than the left tire the entire time you were on the road for California and back.
Now, it's a brand new car. Am I going to visibly see this wear and tear? Like, will I be like, wow, the treads are missing in the middle?
Of course not. It barely shows.
5 years later, though,
Yep.
now this M3's gone through a couple services. I'm at I don't know, 38,000 miles. They lift that car up. The mechanic comes out and says, hey, your right front tire
Yeah.
is wearing inappropriately for some reason. The inside is like inner left, bald. Outside, though, looks fine. They're going to tell me I have to do what? 2 things.
Right. You have to replace the tire, and you have to realign the car.
Wait a second. They do alignments?
They do. They fix the root cause of the issue.
Now, the only difference is a tire is dead.
Yeah.
It's an inanimate object. Wouldn't it be great if tires could regenerate?
Heal themselves?
How cool.
That
So
would
it
be
just
cool.
automatically keeps retreading itself.
Yes.
But your
Realigning
body has the capacity to retread itself. So let's go through this analogy. I'm sleeping on my side inappropriately. I got a ton of stress. My boss gave me a new desk, but like the phone is way over here and the computer screen doesn't line up with my keyboard. So I'm always like this working, and I reach and I have to go like this to hold the phone, right? So
For those
what
of you
am I
that can't
doing?
watch,
I don't know if they can see that.
his shoulders
What
are
am
all
I
the way to the
doing?
right, his head's to the left, his hips are back to the right. It's all over the place, right? Throwing yourself out of alignment and staying in that position for hours.
And then I get home and I'm like, oh, I need a good massage. Yeah, maybe. But week in and week out, I hit 10 years of this office. I'm
Yep.
like, I go to my doctor, man, I don't feel good. They do an x-ray. Man, you got arthritis in your neck. Your hip's like stage 2 arthritic.
Yeah.
And you're 43. Makes sense. Here's your pain pills. So let me walk through this analogy. Okay, I'm going to pick just a joint. I think most people get arthritis in their hip and their knee.
Hip and knee.
So let's say I've got arthritis. My doctor just told me I'm arthritic. I'm even osteopenic, and I want to get this thing fixed. What is the medical answer for this?
Sure. Well, they're going to start you with taking drugs, right? We talked about that in the first half of the show, right? And they'll give you the Tylenol, the Motrin, Oxy if you really
Maybe
need it.
if you're like in super
Right,
pain.
might give you some topical CBD stuff, or there's some other topical medications they'll tell
And
you
how
to throw
about
on your
like
hip.
Fosamax and all the osteoclastic,
Sure.
mastic? Let's build bigger bones, right?
Yep.
Stronger, healthier bone drugs.
Yep. And so then you take those for a couple of years, right? And maybe your pain diminishes for a little, but have you changed the alignment? No. So then the pain continues to get worse and it comes back again, and you're trying to still live your life. So the pain just continues to fester and get worse to the point where you go back, they take new x-rays, and they say, there's been even more degeneration. You've got more inflammation in that hip joint.
And I'm telling them like it's locking up on me.
Yeah.
I can't even walk without shearing pain.
Right. Missing days from work maybe.
So
And
what's the next step?
Here's the medical success story. Hey, we'll just replace your hip for you.
Yeah.
Let's just take out the entire joint and replace it with steel rod and whatever
And a
other
plastic ball
titanium
and
rod
cap.
and and
Listen,
then some plastic pieces.
And they're so good at it today.
They are.
Like I'm telling you, it's like a outpatient procedure
Yes.
now. You go in, they slice you open, they saw your bone out. I know it sounds disgusting. Hey, look, if you really want to have nightmares, go to YouTube and watch
a hip replacement.
Watch a hip replacement
Yep.
video. It's disgusting. Anyway, like and they stitch you together. You're out the same day, guys.
Yeah.
And they even tell you, move, walk around. Now you got to wait about 6 or 7 weeks for the scar to heal and for the stuff to go down.
Yep.
And there's some PT and OT, but here's what's crazy. Everybody that's done this, what do they say? Oh my gosh,
So much better.
my hip is like 1,000% better. I don't feel any pain. Yeah, but you know what? You can't, because it's fake.
That's right.
Those metal rods, they don't have pain fibers on them.
It's just like the tire example.
The plastic cap that they welded into your hip so that the socket would fit into it, no pain receptors.
Right.
So of course there's no pain because you don't have a hip anymore.
Yeah.
Okay.
Crazy.
Now, I do the alternative. I've been listening to the Ask Dr. Ernst show. I heard these two doctors say, hey, there's an alternative approach.
Of course
Walk me through this process. I come to the clinic.
Yeah.
What am I going to have done to me?
Well,
how are they going to help my hip to get better?
Yeah, so 2 things. We're going to put you through a neurological exam, guys, so we can see what your nervous system's doing, right, where there might be some abnormal firing patterns. And then what's going to probably most interest you, and it's going to be extremely important for us as well, to take a set of x-rays to see.
Now, are we x-raying their hip?
Well,
We can.
We can.
But what does that tell us?
But,
yeah, we
right.
see the arthritis. So where do we x-ray?
Yeah, we're going to x-ray your spine, right? And here's what's crazy, right? For the initial x-rays that we take on patients, we take whatever's going on in their lower body out of it by having them sit down.
Yes.
So we can see what's going on with your spine, what compensations, are you in or out of alignment, what joints in your spine may be out of alignment. That could be leading to other alignment issues down and out your appendages.
So let's throw a curveball. Is it possible for an alignment issue to be in their neck that's causing the arthritis in their hip?
Absolutely.
See, guys, I'm telling you, like what we say, you're going to be like, that's insane.
Right.
That's like saying milk and cookies causes heart disease. Well, they do,
They do.
But you didn't think they did.
Yeah.
So you do this full assessment. We're looking for alignment, just like the mechanic. Man, he's checking your tires.
Yep.
The right one's 14 degrees internal. What we got to do is go in there and twist that little screw. I don't know if it's like this anymore. Old cars, you used to twist this little screw, and the screw would push the tire straight. Then they would bring it down and measure the alignment as the wheel's running. Okay, so like, can you have an alignment issue in the joint causing the problem?
Yes.
But could you have perfect joint motion and have an alignment issue somewhere else and have that also cause a problem?
Right. And that would be a compensation, right? It's not the primary problem,
Yes.
but there's a primary problem somewhere else that's leading to your joint problem.
I'm putting you on the spot. I know you know the answer for this. If the arthritis is in my ankle, what's usually the joint that's out of alignment?
Gosh, okay. So I have a couple thoughts on this actually. But if you're having arthritis in your ankle, the main issue it's probably coming from the pelvis. It's probably coming from the low back. One of those is way out of alignment.
Good.
But here's the thing, guys. The ankle is a mobility joint.
Yes.
So it's totally plausible that there's an issue at the knee as well, which is a stability joint. And then that can cause major issues down at the ankle too.
So watch this. I was taught years and years ago that where the arthritis is never where the problem is. It's always the first joint
above it.
upstream.
Yeah.
So your
I've heard
ankle's
that
way
theory.
down there.
I've heard that
So look,
theory.
if you have a lot of arthritis in your hand, like your knuckles are all bony, then it's usually either the wrist or the elbow. Now, it's very rare for people to have arthritis in their elbow, but it can happen.
Right.
That would mean shoulder, neck.
Yep.
Now, shoulder arthritis.
All the time.
Oh.
Right.
So guess what the next joint up is? Neck. Now watch this. Neck arthritis, skull. That is never really skull arthritis. But left ankle, I think knee and hip. And then if knee and hip are involved, I think spine and sacrum.
Yep.
Now watch this. If you've got lumbar arthritis, which like 98.999% of Americans have, then that's thoracic and neck.
Yep.
So now I get this spinal exam done and it comes back showing an alignment issue here, there, whatever. What else are we checking? Like we have them step on this very special scale, right?
Yep.
And what does that thing do?
Yeah, so that looks at a number of different things. That's where we can get into a little bit more of the metabolic processes that are going on in your body. So we're going to look at the amount of muscle that you have, the amount of fat that you have, where that fat is, if it's distributed properly.
Yeah,
it's
so
going to talk about, do you have weight properly balanced between your right side of your body and your left side of your body? Because those are all going to be equated to certain alignment issues. And then it can also go deeper into the inflammatory side of it
So
too.
watch this. My right hip is arthritic.
Yep.
I hop on this scale. My right leg has 3 pounds more fat than my left, and my right leg has less muscle than my left. What does that tell you as a functional physician?
Yeah, so it shows that compensation pattern that you're doing. It shows that you are now using way more of that opposite side. Yep.
And you're really fatty on the side of the arthritis.
Right,
And
because
what is
from
fat? It's
it-
a insulator,
yep.
protector,
Yes,
it's
it
a
is.
nourisher. So we go, whoa, not only is it structural, but it's metabolic. And what
Exactly.
are the classic things people are deficient in that cause this metabolic breakdown?
Ooh. So the biggest one that comes to mind when I think of this is most likely your omega-3s,
Because they are what?
right? Because that's related to fats.
And they're
Any of
anti-inflammatories.
your anti-inflammatories.
And arthritis, the itis, is an inflammatory. Look, excuse me, if you have pancreatitis, what's inflamed?
Your pancreas,
If you have neuritis, what's inflamed?
a nerve somewhere in your body.
If you have arthritis, it's your
Joints, right?
What if you have scleritis?
Ooh, that's a big one. So yeah, that's with the eyes, right? Inside
So
the eyes.
all it is, guys, you could have skinitis, inflammation, dermatitis. I was just trying to make a joke. Oh man, I have so much dermatitis. My dermatological doctor gave me a cream. Now you got inflammation of your skin. Okay, so itis is inflammation. So of course the omega-3s.
Right.
What are some great omega-3s they can start taking now that could actually reduce their pain in minutes?
Yeah. Well, there's some great supplements out there, right? There's one I know that we have specifically for patients here in our office, but probably the best source that I know of is fresh, wild-caught salmon.
Yeah. So see, everybody runs out to take these fish oil pills. You got to be careful with that. You should be getting your anti-inflammatories through your food. Grass-fed butter, wild-caught salmon, wild-caught small fish, sardines and anchovies, herring, etc. You know, grass-fed
Low
beef.
toxic fish.
What about plant-sourced fats? Nuts and seeds, walnuts, pistachios, macadamia nuts, Brazil nuts, excuse me, flax seeds, chia seeds. I mean, I'm telling you, you got such great components. Now, let's tease some people. Remember I said before, there's something you can do that literally can take your arthritis pain away in minutes to hours.
Yeah.
And this involves something drastic.
Yep.
Because you got to do this, which is something I'm teasing with. And when you do this for 24 hours, what do most people tell us in our office? Hey, I'm on 24 hours of no.
Right.
And
I
my
feel
joint pain is
amazing.
gone.
Right.
Walk them through this.
Right. So what Dr. Ernst is getting at, guys, is when we talk about arthritis being an inflammation of the joint, you've got to remove whatever is triggering that inflammation. And would you believe that a lot of that inflammation is being triggered by the foods you're eating? The foods that are leading to digestive distress, which is then leading to inflammation not only within the digestive system, but possibly in the joints that are bothering you so much as well.
So they call this reactive arthritis.
Yes. So you've got to remove the triggers that are leading to that arthritis reaction in those joints. And that could be a number of things, right? And that's very specific for each individual, but a lot of times it can come down to some of the grains, sugars, processed foods. Those are the big culprits.
We have a list for them. So these are the top most common reactive foods that cause arthritis. Why don't you give it to them?
Yeah, so here we go, guys. Ready? Coffee, tobacco, all sugar except natural fruits, of course. All citrus fruits. Ooh, some of those are.
That's tough, right?
That is tough.
Grapefruits.
I love though. I love some citrus
oranges.
fruits. Yep. Wheat, corn, and soy, as I mentioned earlier. Animal protein.
That is from corn-fed, wheat-fed, soy-fed animals.
Right. Non-grass-fed animal products. Dairy, so milk, ice creams. Vegetable oils. So what they're probably talking about here is, your rapeseed oils, your canola oils.
Nobody calls it rapeseed. Just it is rapeseed oil, but it's termed canola.
Okay.
Wesson, Mazola.
Gosh.
Right, all you Mexicans out there that are frying your food in that corn oil.
Yep.
Peanut oils, these kind of things.
And then last one is artificial sweeteners.
So listen, did you know that most people for breakfast have a cup of
coffee?
Yeah, and they usually have some sort of fruit, grapefruit.
Yep.
And they eat a bowl full of wheat, corn, soy, and rice and oats and stuff like that.
What do they add to their coffee typically?
Add their dairy to their cereal and their coffee.
Yep.
Guys, that's a recipe for reactive arthritis. So the secret is we cut out all of these inflammatory foods. In fact, you cut out all food for a day, and you drink what?
Yes.
What is the drink that makes the arthritis pain go away sometimes as little as 4 or 5 hours?
Right. Because it's cutting off the inflammation. It's bone broth, guys. You need to go on what we would call a bone broth fast, but it's where that's all you consume for 24 hours. You'd be amazed at the results that so many people have.
It's the bones from animals. And if you really, really want to do this the right way for arthritis, you get a joint, like a knuckle, a beef knuckle. Now, their knuckles, by the way, are like that big. And you take the whole joint. Now, look, it's gross. I know people are like, bleh, but watch. You can wiggle that joint back and forth. It's got the capsule. It's got the meniscus. And you take that whole knuckle and you put it in water.
Yep.
You add some apple cider vinegar, some garlic and onions, and you boil this stuff. And then you simmer it. And that juice is basically joint extract.
That's right.
Now, what is it super high in?
Yeah,
like
so
it's loaded with
a couple
certain
proteins,
things.
specifically glycine and proline, that are going to be super important for allowing proper joint joint function. And then if you get, like what Dr. Ernst is saying, if you go and get the knuckle, you're going to get some of the cartilaginous and soft tissue portions. And so there's some really important proteins, hyaluronic acid, and a few other enzymes that are going to really help with the joint health.
Glucosamine, chondroitin sulfate,
Yep,
hyaluronic acid. Now
Yep.
watch. Some people say to us, well, doc, I went to the vitamin shop and I got a bottle of glucosamine, chondroitin sulfate, hyaluronic acid, and MSM, and man, my joints are feeling great. Yeah, but you're just medicating them.
Yeah.
What bone broth does is it also seals your gut. It lowers your sugars. It helps your triglycerides to stabilize because you're not eating the reactive foods.
Exactly.
So what is the secret? We said we'd give it to you guys. If you're waking up and you got severe joint pains, or if your knuckles are like literally blistering and I want you to do a no food 24-hour bone broth fast with a joint from a healthy grass-fed cow.
Love it.
And I'm telling you, I've had patients be like, I woke up in the morning, couldn't move, drank 2 cups of bone broth. 2 hours later, wow. 4 hours later, we even had a gentleman who had to use a cane to walk around in the office. He did a couple days of broth fasting, comes in and he's doing squats right in front of us.
That's right.
I'm telling you, the secret is out. If you have arthritis, remember, it's an inflammatory condition. It's not genetic, it's not your age. Your diet could be triggering it. We got the list of foods: coffee, tobacco, all natural sugars except for fruits. So I'm sorry, all sugars except the natural sugars that are found in fruit. Anything citrus, I hate to say this, guys. Grapefruits, tangerines, what else? Oranges, lemons and limes. Most people don't eat lemons and limes though, but they can if you eat them. Wheat, corn, rice, soy, oats, animal proteins that are corn-fed, dairy, all dairy, yogurt, cheese, my God, vegetable oils, excuse me, and then artificial sweeteners, saccharin, Sweet and Low, Splenda. So watch this. You cut that all out, you fast for 1 day, and most people say, look at this. But remember again, that's just making it feel better. We got to get the alignment corrected. We got to find the source of the inflammation, and that's what we do with our patients.
That's right.
Yeah.
There's always a deeper cause, guys. So we got to figure out what's going on with the nervous system too. Don't just leave it up to, well, hey, can I just treat it and move on? Life's not about treating what's already a problem. Let's figure out the root cause, and let's see what we can do to help you.
That applies to everything. It can be a cancer, a heart disease, a diabetes, an MS, a Parkinson's. This is why right now I recommend, as we close our show out, pick up your phone, text your name and email to 704-906-2094. What are you getting? Well, we're replaying the seminar we did today. It was how to destroy diabetes, how to lose weight, how to get your energy back, how to bounce back from all chronic disease. And you're free right now, 704-906-2094. Call or text, name and email, and we'll also give you the ebook that we've been giving away. Over 3,000 downloads. I mean, my God, we got such great feedback from that one. That's also yours free. The webinar is free. We just want to teach and educate you how to heal yourselves. Thanks for being here, Dr. Chris.
Thank you, Dr.
Honor
Chris.
as always. And listen, thank you for listening. Now the ultimate. Click the like, click the share, share this, post this to your feed. Those of you watching us on Google or Twitter or Instagram or Facebook, share. That's the idea, guys. We'll see you next week. Thanks so much. Have a good week. Until then, bye-bye.